Will the Committee of Supply please come to order? This section of the Committee of Supply will now resume consideration of the estimates for the Department of Health, Seniors, and Long-Term Care. Questioning for this department will proceed in a global manner. The floor is now open for questions. Member for Roblin.
Thank you, Honorable Chairperson. I'd like to start today with Health Human Resources and the number of healthcare workers that the government says that they've hired. I'd like to know of that 1,600 number, how many are net new, how many were existing positions, how many are full-time, how many are part-time, and if we could please get a breakdown of where in the province those positions are located, as well as what the positions are.
Thank you, Member. Minister of Health, Seniors, and Long-Term Care.
Thank you, Chair. There was a question asked by the critic yesterday regarding breast health specific to mammographers, so I'm happy to provide a little bit more information today in that regard. So the current number of mammographers is we've got 18 FTE, and as I stated yesterday, we've been working at proactively identifying technologist students as they're doing their training and reaching out to them proactively to offer them training opportunities specific to mammography, and of course offering them job opportunities where we need an increase in capacity for that service. We were successfully able to identify almost 10 students through that proactive outreach in a partnership with Cancer Care Manitoba. 3 of those have already graduated and are actually working as mammographers right now, which is really exciting. And I think that's a really important thing to talk about because it highlights the benefits of proactively reaching out to learners, healthcare learners, engaging with them, and offering them opportunities to enhance their education and training and job opportunities within the healthcare system. Again, this is an approach that our government undertook for the first time. This has not happened previously, certainly not under the previous PC administration, but I don't know that we can identify a time where this has really happened in this way previously. And so if we think about the fact that we know our government is doing the work of lowering the breast cancer screening age, also actively doing the work to ensure that we hit that Canadian national target of screening 70% of eligible populations, we know that's going to require more healthcare human resource. And so we cannot do things the way they've been done. We have to think outside of the box. And if we hadn't proactively worked with Cancer Care Manitoba and our partners, Red River and other folks, to reach out to these healthcare student learners, then we would have 3 fewer mammographers practicing right now in Manitoba. So, our government values each and every healthcare worker that is a part of our healthcare system across the province. And so I want to thank those 3 mammographers who are working in breast health right now in Manitoba. Thank you for being open to the opportunity to get that additional training right after you completed your program. Thank you for being willing to be gainfully employed as a mammographer in Manitoba. You are part of a healthcare system and team and program that is saving the lives of women and those who need this care across our province. So the work you do is invaluable, and my hope is that that these folks and others can really spread the word about why working and pursuing this path of education and career in healthcare matters. I had the opportunity with the MLA for Seine River to actually go to a breast health clinic here in Manitoba and meet with a technologist who's been doing the job for, I believe she said, I could be mistaken, I don't want to misspeak, but it was decades, a couple of decades, I believe. And she provided a lot of information in terms of what that career path has looked like for her, the evolution of technology in this space, and really opened my eyes to the opportunities that we have as a government to strengthen this area of healthcare. Minister Fontaine, who's the Minister of Families in our government caucus cabinet, has a family member, folks may be aware, she's won awards for this, who is developing mobile breast cancer screening technology that is very novel, that will support the ability to get breast cancer screening to more communities that need access and have limited ways of doing so. So right here in Manitoba, we have really incredible women doing really amazing work and leading the way for how we can strengthen breast cancer care in our own province. And I think that's really exciting. And as a government, we value greatly the relationships that we're building so that we have this information, so that we have partnerships that allow us to reach more Manitobans and improve the healthcare outcomes of women across our communities.
Thank you, Minister. For all members, a gentle reminder that in Committee of Supply, please address the members by their title or their constituency. Thank you. Member for Roblin.
Thank you to the Minister for that additional clarification on the topics we were discussing yesterday. I would just like to draw the Minister's attention back to the question I just asked. Hopefully they've now had enough time to gather some data from the staff.
Thank you, Member. Minister of Health, Seniors and Long-Term Care.
Thank you, Chair. Our government has shared this information previously. And more recently, we've talked about the 1,600 net new hires in terms of healthcare capacity. And, at first, months ago now, when we were reporting on where we were in terms of the 1,000 net new healthcare worker target that we had established, we reported 1,255. We moved beyond that pretty quickly, and we're at 1,509, and very quickly got to 1,600. I've given examples before in this estimates committee of experiences that I've had when I've been out in community at different events that are healthcare related, and seeing the growth, just the growth in the sheer participation of healthcare workers, which I really think tangibly illuminates the impacts of all the work and partnership across departments and with stakeholders that we're seeing in our communities in terms of healthcare and the recruitment, retention benefits that we're seeing of this. And I believe I also talked a little bit about the fact that when I came into this role, there was no real structure in place, no foundation in place in terms of how to track this information, which to me was really outstanding, or not outstanding, it was actually terrible, but it was concerning, rather. It was really, really concerning that there was no established practice of how to gather and disaggregate that information and then use it to make informed healthcare decisions, investments, and policies that would support improved healthcare outcomes by way of having people on the front lines to provide care. And this is something that nationally, when you talk to other health ministers or you listen to other premiers and other provinces and territories, you begin to see very quickly how important it is to have that information and the impact of having that information, what it means in terms of your ability to be strategic and take an informed approach. And so our team worked very hard, the department worked very hard at establishing a strong foundation and also making sure that we are sharing that information clearly and transparently with unions. It's really important for us that the unions feel confident in the information that we're sharing and we're talking about, while recognizing that for the net new numbers that we have been able to see be a part of our healthcare system, it's not nearly enough. It's just not nearly enough. There's much more work that we have to do. There's much more work that we are doing. Our 25-26 budget adds an additional 176 healthcare training seats. That really speaks to the urgency of making sure that we have more training capacity in order to make sure we have net new healthcare workers on the front lines. The number, the 1,660 number in terms of net new, the breakdown of that is 166 allied healthcare professionals, 591, so nearly 600 healthcare aides, 647 nurses, which is a huge gain. Under the previous government, we had a net loss of 300 plus nurses. Now we're seeing a net gain of nearly 650 nurses in one budget effort. For PAs and CAs, physician assistants and clinical assistants, we've got 33, midwives 7, residents 49, and physicians 167. The midwives number, although may not be as exciting as some of the other numbers like 167 physicians or 647 nurses, that number is really, really important. And beyond the net new 7 midwives, we've been working directly with the Midwives Association of Manitoba to understand what the needs of midwives are across our province, where we need to ensure they have job opportunities. And so what we've done, similar to all healthcare learners, is make sure that midwives have job opportunities, letters in their hands from the Premier and myself before they complete their studies. And we've created job opportunities, actual positions for them across Manitoba in different regional health authorities so that they know there's a job waiting for them as soon as they're done their studies. So that's more work that's work that we're doing, work that we're going to continue to do. And I want to thank midwives. I know they had a rough go with the previous government who cut their programming, cut their training at UCN, and didn't treat them with respect. We respect you folks. We appreciate everything you do for Manitobans, and we cannot wait to keep strengthening this area of healthcare alongside you.
Thank you, Minister. Member for Roblin.
Thank you. I just have a couple of follow-up questions. I didn't hear, and maybe I missed it, the number of allied health professionals, and I'm wondering if I could get a breakdown of allied health professionals that are included within that 1,600. I'm also wondering of the 650 nurses that the minister mentioned, if that's 650 FTE, or how many FTE do those 650 individuals account for?
Thank you, Member for Roblin. Minister of Health, Seniors and Long-Term Care.
Thank you, Honorable Chair. While we wait for a few pieces of information, I can talk a little bit about the nurses. And so the 647 net new nurses, those are individual people, not FTEs. Those are individual nurses who have been hired into the healthcare system. Ideally, it'd be great to see nurses, each and every one of those nurses, perhaps pick up a full-time FTE or a 0.8 FTE, 0.7 FTE. We know that there are a whole wide range of reasons why nurses may choose to pick up or be employed under a particular FTE. I remember back when I was a new grad and a new practicing nurse. During that time, a lot of nurses, I would say most nurses, were trying to find a full-time FTE. That was really the thing that new grads wanted, and it was difficult actually at that time to find that, find a full-time FTE, find a full-time FTE exactly where you wanted to practice, the site you wanted to practice in the region, the unit you wanted to practice on, the way that you wanted to practice. And so, sometimes you had to find a job and start maybe with an FTE that was a 0.6 or something else and pick up shifts or float, or a 0.5 in one location and then maybe a 0.4 or something somewhere else. And things over the years have changed a bit, right? They've actually changed a lot where in some cases, in a lot of cases, yes, nurses are looking for that, but they're also looking maybe for slightly lower FTEs to allow them a bit more professional flexibility, maybe to accommodate work-life balance or dynamics in their own personal lives and what their needs are. And our government recognizes that it's really important to meet nurses where they're at and to support them working in the public sector. Like, first and foremost, we want nurses working in the public healthcare system. And so the process of, first of all, making sure that nurses can get to the table and bargain fairly was really, really important. That's really where you're able to have a lot of those important conversations and work out those details. Under the previous government, nurses couldn't even get to the bargaining table for years and years. And what was able to successfully be negotiated and built into a pretty historic collectively bargained agreement was the ability for nurses to work full-time hours and be flexible in the way that they work up to those full-time hours, but also work slightly under those full-time hours, not a 1.0 FTE truly, and benefit from a full-time incentive, which is novel. It's not something that we've done in the province before. I don't really know that I don't believe it's happening anywhere else. And actually, the way that it's structured, and this started rolling out on April 1st, I believe, if I'm not mistaken, April 1st, that if you're a nurse and you work full-time hours for 6 months, let's say, out of the year, then you will benefit from that full-time incentive because the incentive is distributed biannually, twice a year. So again, even that model being structured in a way that allows for nurses to have flexibility in being able to meet their needs and being able to support a strong public healthcare system. I think that's a really important approach, and being able to implement an approach like that in partnership with the Manitoba Nurses Union, who recommended the agreement to their members and who advocated for this particular full-time benefit, incentive benefit to be in place. It's also really important to take a look at what the impacts of that are. And so being able to measure that, and we intend to do that as well. So to answer the member's question again, the 647 net new nurses, those are all individual nurses practicing here in Manitoba at various sites. And we look forward to another 647 net new joining the front lines.
Thank you, Minister. Member for Roblin.
Thank you. And yes, certainly flexibility is something that nurses, but in fact, a lot of health professionals and people across all fields seek, depending on what stage of their lives that they're in. But I'm wondering if I could also get a breakdown of the allied health professionals that are included in that number, that 1,600 number? How many and from which job classifications?
Thank you, Member for Roblin. Minister of Health, Seniors, and Long-Term Care.
Thank you, Chair. So in regards to the allied healthcare professionals number, it was 166. And I'm happy to take under advisement getting some more clarity on a breakdown of that for the critic. I can share a bit of information in regards to the net new hires across regions. The caveat to this number being that it doesn't include doctors and residents. Those numbers are held elsewhere. So this number will be a little lower, but it's because it doesn't capture those folks. And separately, so as part of this, and it's not captured in our notes, but I'll share this with the member, that the Interlake Regional Health Authority has 5 of the midwives, and the Northern Regional Health Authority has 2. So the further information in terms of the breakdown of the net new healthcare workers, we're looking at 35 at Cancer Care, 128 for the Interlake Regional Health Authority, Interlake Eastern Regional Health Authority, 58 for the North, 99 for Prairie, 310 for Shared Health. Southern is 178, and the WRHA is 632. That totals 1,440. So as I said, it doesn't include physicians or residents, and that list didn't include midwives, but I've given you the breakdown for midwives and where they are. In terms of the net new hires, we know that there are some regions that, and there are folks rather that don't work, and the physicians rather, to clarify the physicians piece, they don't work for the regional health authorities. That's why they're not captured in these numbers. But in general, in terms of the distribution, the critic, I know, is well aware of some of the challenges regionally in terms of hiring, and not all regions can hire equitably, quite frankly, with the same level of ease. There are some different approaches and creative approaches that need to be taken in terms of hiring in the North or Prairie Mountain, just as 2 examples. And the Retention and Recruitment Office has been working really hard to build relationships with every single regional health authority to understand their unique needs, even as much as a site-by-site basis, to work with the sites and work with the municipalities to do that work. What we've really come to learn is that, one, first of all, collaboration partnership makes a huge difference, but regions, municipalities were sometimes unintentionally almost competing with one another because they're all, looking for resources that for a long time have been tough to find. And so the Retention and the Recruitment Office really serves as a way to streamline those efforts and a unifier, right? The Retention and Recruitment Office does a lot of work to alleviate some of the pressures that these folks were navigating and really making it easier to do some of this work. On the physician side, that's just one example. I think that's a really strong example because we've got 2 physicians at our Retention and Recruitment Office who are really wonderful folks, so Dr. Clausen and Dr. Rezazadeh, who are phenomenal physicians, but they're people who really understand how to talk to their colleagues. And I've heard this a lot from physicians, that the best people to recruit doctors are other doctors. And so they've done a really great job helping to guide the work that we're doing and build those essential relationships with municipalities and with regional health authorities, who I think previously had a bit of lack of trust or feeling like they would be heard by government. And now, over time, they're starting to see that through partnership, we can get a lot of good things done. It takes time. So these numbers aren't where we want them to be yet, but they are net new, meaning they account for people who have retired or left the system for a whole variety of reasons. These are net new numbers, and we have to do more. We're going to do more, and we're going to keep doing that in partnership so that we can keep seeing the net benefit of that on the front lines.
Thank you, Minister. I wanted to take a moment to appreciate everyone for the meaningful questions and answers in this Committee of Supply. Member for Roblin.
Well, I think I speak for
probably both sides of the table when I say that we appreciate your efforts as well. Honorable Chairperson. Can the minister identify what their hiring targets are for this year? I know that in the previous fiscal year, they had stated publicly sort of what their targets were for different types of health professionals that they wanted to hire. I wondered if there are targets for this year as well.
Thank you, Member for Roblin. Minister of Health, Seniors, and Long-Term Care.
Thank you, Honorable Chair. Our government, even before the last 2023 election here, was talking about what we needed to do in order to staff the healthcare system, what approach we needed to take, what targets we needed to set and establish. We knew that there was a net loss, just as one example, of nurses under the previous administration, a net loss of 300 nurses. And we knew that we needed to go further. We needed to ensure that we could have a net gain of those lost healthcare workers, but go further than that. And so we articulated a target of 4321 as a plan to retain, recruit, train, have net new numbers in our healthcare system. And we've been working really, really hard to meet those goals. And we've built some really important partnerships along the way in order to do just that. It was a priority that was articulated in my mandate letter. It was explicitly stated that the priority that I needed to address as health minister was first and foremost staffing the front lines of our healthcare system. That you can build hospitals and personal care homes, as our government is doing, reopen emergency rooms, but the only way that you can actually provide care and quality care is with people, with the experts at the bedside to do just that. And so we are focused on getting people, as many people as possible, on the front lines of our healthcare system. We know that fundamentally one of the most important pillars in doing that work is retention. It is about retaining healthcare workers. And so, again, I've said this before, but one of the ways that you can retain and improve culture in healthcare is by making sure that healthcare workers can bargain fairly. It's showing up to listen to healthcare workers. I've had the pleasure to be at many different sites now across the province for the listening tour, which is ongoing. And even outside of the listening tour, the Premier Special Advisor on Nursing and Safety, the MLA for Tuxedo, she's been doing great work in outreach, talking to nurses and healthcare workers. Had the opportunity to meet with folks on the front lines with her, including in the north. I believe we were in Thompson together, talking to nurses there and healthcare workers there. And I think you can tell by the way that our Premier has structured our team and the mandates that he's given to me, and he's also given to other ministers, and the roles that he's had really, really amazing history-making MLAs, like the MLA for Tuxedo Inn, should tell Manitobans and really signal that we take retention and recruitment and training of healthcare workers very seriously. We've come a long way in a pretty short amount of time in terms of our net new healthcare worker numbers, but we recognize, again, there's so much more work to do. And so that target of 4321 that we talked about during our campaign remains a really important target for us as a government. And we've also, along the way, set new ones. The critic is correct. We set in our first budget a target of 1,000 net new healthcare workers, and we really blew past that. Our priority is getting as many people as possible on the front lines of our healthcare system. Manitobans deserve to go anywhere they need to access healthcare and have the people there to provide it. But in that, there's also an understanding that we need to have healthcare workers that look like the people they serve. We need to have representation on the front lines of our healthcare system. And so we've been working with folks like Dr. Anderson, who's an anti-racism and equity expert here in the province, who's internationally renowned for her work. We've been working with the University of Manitoba, with the Minister of Advanced Education and Training, to ensure that we are taking the necessary steps to encourage and support diverse communities in pursuing post-secondary or non-post-secondary healthcare training opportunities. We know that when you have a representative workforce, that you improve the healthcare outcomes of the people that you provide care to, and that's a fundamentally important approach that our government knows there's a lot of value in. The data backs that up, the evidence backs that up. There's more than enough research to say that's the right approach to take. So we're going to keep doing just that.
Thank you, Minister. Member for Roblin?
Thank you, Chairperson. I just wonder if the minister has had time to look at what their targets are for this fiscal year for hiring.
Thank you, Member for Roblin. Minister of Health, Seniors and Long-Term Care.
Thank you, Chair. The 4321 breakdown was 400 doctors, 300 nurses, 200 allied health, and 100 healthcare aides. Those are the targets. And in terms of what our targets are for the 25-26 budget, it's a great question. Our government built into this 25-26 budget, it's a massive increase. It's a historic increase to healthcare. It's $1.2 billion, 14% increase overall globally for health, $780 million of which is paying the wages of healthcare workers. And, folks have asked, the media has actually often asked me, that's a lot of money to spend on healthcare. It's a lot of money to spend on healthcare workers. And as a government, we say, yeah, and it's worth every single penny. We're investing in healthcare workers. We're investing in the people and investing in taking care of the people who take care of us. And that's really, really important. And, as a government, we want to make sure that we are doing what we can, recognizing it's going to take us many years, to really repair the damage that was done and see some of the larger improvements that we all want to see in healthcare. You certainly do not, you don't fix 7.5 years of that kind of damage to healthcare overnight. You don't fix it in a year and a half. And I've heard a lot of experts tell me you don't fix it in one mandate. It takes time. I'm talking about many years of work that's going to go into repairing healthcare and making it the public healthcare as strong as Manitobans deserve. But we're committed to doing that work. We're absolutely committed to doing that work. And it really is an all-of-government approach in getting that work done. Our government has been laser-focused on ensuring that healthcare, we action that healthcare is our top priority. We action that we're making healthcare better for Manitobans no matter where they live. And so our priority in terms of what's our target for healthcare workers in the 25-26 budget, as many healthcare workers as possible, as many healthcare workers as possible. We've seen what can be done when we all work together and put our resources together at the table transparently. We, again, blew past the 1,000 net new healthcare worker target. We've added additional training seats, and we're actively piloting innovative ways to get more folks on the front lines, including the internationally educated healthcare worker pilot program specifically for nurses, which we're going to see about 80 graduates of that program. When I came into this role as minister, the former PC administration had spent millions of dollars to establish a program to recruit nurses from the Philippines. In July of 2023, that was their target window. They said that they would have 300 net new nurses in Manitoba as a result of those millions of dollars spent. When I came into the ministerial role, it would have been in October of 2023, there was one person hired. I know it's bad. That's why the window is slamming that way. It's emphasizing how dismal the performance of that program, that effort under the previous government was. And, under our administration, we've been able to modify that program, modify that effort, and as a result, we have dozens of internationally educated nurses who have joined the front lines of our healthcare system. Like I said, we've got a pilot program that's going to see about 80 of these nurses join the front lines, which is great. But again, we know there's much more work that needs to be done. And so to answer that, the critic's question, as many healthcare workers as possible. We have added additional seats, so those numbers are going to increase. And I also want to shout out just for a second the Nurse Practitioners Association of Manitoba. I know that the MLA for Tuxedo has friends who are nurse practitioners, as do I. We've been able to meet with the representation from NPAM. Ashley, who is their president, is just a fantastic nurse practitioner and a great leader and advocate for NPs. And there's something really unique that's happening in Manitoba as of 2026 with the training. So in our first budget, our government doubled the nurse practitioner training seats. And by 2026, we're going to see nurse practitioners be able to specialize in their training so that their focus is outside and broader than family medicine, which is really exciting.
Thank you, Minister. Member for Roblin.
Thank you, Honorable Chair. I will say I'm a little surprised to hear that there are no hiring targets specifically for this year. I think targets are a way to measure progress, and without targets, the bar is really low. I mentioned targets specifically because I have some questions about paramedics. In the previous year's budget, the government promised to hire 90 net new paramedics. And they fell very, very short of that target. And so maybe that's why there isn't a target now. I don't know. But that target at the time, in speaking with some folks who provide paramedic education, they told me that even if every paramedic training program in the province graduated folks at full capacity, they would never be able to turn out 90 paramedics in 1 year. So I would like to ask the minister, what is the status of the 90 paramedics? I think at the last update where specific numbers were provided, there were 14 paramedics of the promised 90. And what is the plan to increase that number?
Thank you, Member for Roblin. Minister of Health, Seniors, and Long-Term Care.
Thank you, Chair. On page 44 of our 25-26 budget, we have a section titled Retaining and Recruiting Paramedics. After expanding the advanced care paramedicine program, we are now providing financial support to students. Additionally, this year, we will add a position to our recruitment and retention office dedicated to recruiting more allied health professionals, of which paramedics fall into that category of allied health professionals. Our government has taken significant steps to find innovative ways to retain, recruit, and train allied healthcare professionals, including paramedics. I do find it interesting that the critic is talking about 90 paramedics, and I think rightly asking how are you going to achieve that target. We've set ambitious targets for ourselves as a government because Manitobans went many years without a government who had ambition to improve healthcare. The ambition was the opposite, was to harm healthcare. They deserve a government that sets ambitious targets in terms of staffing the healthcare system and making it better. 90 paramedics were lost under the previous government. It's a substantial number of paramedics, but it's not just about the loss, the net loss of 90 paramedics. How does that happen? Like, one has to ask themselves, how does that happen? And how that happens is when a government chooses to, for 6 years, freeze the wages of paramedics, of allied healthcare professionals, and refuse to bargain fairly with them. Shut them out of career advancement opportunities, training opportunities, shut them out of practicing to their full scope across rural Manitoba and the north. And the damage that was done as a result wasn't just the loss of 90 paramedics, it was the loss of an appetite to pursue that career path because for years people said, well, why would I? My wages are going to be frozen, I'm not going to be respected, I'm not going to be able to practice to my full scope, I can't train in ways that would advance not only healthcare, but my skills as a frontline provider in communities. It was really doing everything they could to de-incentivize a really important, really critical part of our healthcare workforce in the province. And our government, beyond setting this target of net new paramedics as part of our allied healthcare net new numbers, has been doing the work to improve the conditions so that we're able to see an improvement in culture, see an improvement in relationships, and see folks be motivated to choose that as a meaningful career path. We've taken real steps like doubling the advanced care paramedic training seats, allowing advanced care paramedics to be hired and to practice in rural Manitoba, which every time I say it, I cannot understand, I can't wrap my head around why a government would think that it is okay to deny advanced care paramedics the opportunity to practice in rural communities. It's just jaw-dropping to me. And that was one of the decisions our government knew we had to make right away, was making sure that ACPs could practice in rural Manitoba. And we're thrilled that that's happening. I was able to meet a paramedic who was taking the ACP training that we made sure was available at the opening of the sim lab at Red River College. This guy was, outside of being like a really cool person, just a really cool human being, he was just so excited talking about paramedicine and this training that he's getting, skilling up and getting this further education, what that means for rural communities where he lives and serves. And we want to see more folks have that opportunity and be just as enthusiastic about it. We have been working through the retention and recruitment office through this new role of a new allied healthcare professional role and lens to find creative ways. There's a gentleman actually who was a paramedic in Mexico who recently moved to Manitoba who really wants to practice in Manitoba and previously would have had no way to find a connection to government or a path forward. And our retention and recruitment office was able to connect with him and support him in finding a path forward to practice paramedicine in our province, which is very, very exciting. Now, we've had interest in terms of paramedics who have been trained as far away as Australia that we're exploring. And of course, our near and dear neighbors, the United States, we know that there are healthcare workers, allied healthcare workers who want to come and practice in Manitoba. I met a paramedic when I was with the MLA for St. Boniface skiing one day, at Windsor Park Nordic Center, the paramedic from the States, who's also considering coming to Manitoba.
Thank you, Minister. Member for Roblin.
Thank you, Honorable Chair. I thought we were doing so well with the tone of our questions and answers till about 20 minutes ago. I don't know what changed. I just want to cede the floor for a few moments to my colleague from Lac du Bonny. I think he's got a couple of questions for the minister and their staff.
No way.
Thank you, Member
that
for
from you?
Roblin. Member for Lac du Bonny.
Thank you, Mr. Chair, and I've got a question for the Health Minister. On behalf of a constituent of mine, the family of the mom and dad are Kelly and John Vincent, son is Ty, suffering with dysautonomia. I wrote a letter to the Minister of Health in July, then another one in October, and another one, I believe, in December, and then another one just recently. The Vincent family has received a letter back. Just taking a look for the certain date, just to make sure I'm right. So from July, when I called or wrote a letter to the Health Minister's office, and then the Vincent family sent in a package over the summer discussing and talking about their son's situation, and then multiple letters after the fact. Finally did receive a letter from the minister's office, and the minister was CC'd on this as of May 6th, 2025, so just recently received a letter. It talks about how an absolute referral from specialists were not sent. That's what the department is saying. But within the package, it absolutely states on how professionals within our great province of ours, actually there were referrals to Edmonton and Montreal and several in Winnipeg, and they were rejected. Just wondering if, I believe the letter was signed by Assistant Deputy Minister Schaefer. I'm just wondering if maybe just to clarify some of what's in that letter, if the minister can possibly get the Assistant Deputy Minister to actually give the family a call so there's no misinformation back and forth through letters, which seem to be taking quite some time, considering that my first letter I sent in was in July, and we've got some form of response from the department. I do understand that the Assistant Deputy Minister was tasked with this case file, but I just figured I would put it on the record today, and hopefully the Health Minister can look into it. I know that they were CC'd on the response to the Vincent family.
Thank you, Member for Lac du Bonny, for your question. I would request you to tie it back to the estimates, if you can. Member for Lac du Bonny.
So thanks, Honourable Chairperson. So I have no problems tying this back to the estimates process, because we know that out-of-province surgeries and various different things have been cancelled, and I know that under extreme situations, the Health Minister has said in the past that they would look at situations, and this situation has been taken forward, and because it has to do with finances and also the sort of the rubber stamp from the Health Minister and her department to be able to go and get these.
Order, please. I would remind all members to use proper pronouns for honorable members sitting around us. Member for Lac du Bonny.
Honourable Chairperson, if you take a look back into Hansard, and I'm taking your advice, I have used the proper pronoun. This time absolutely was an accident, so I absolutely apologize to the Health Minister for using the wrong pronoun, but I was just basically stating my case as far as how this ties into the estimates process, because this would require some some approval through the health minister to get this case moving forward.
Once again, thank you, Member for Lactobani, for your question. I would give you another chance to tie it back to the estimates, supplement of estimates. That's what we're discussing today. So you can try once more to tie it back to the estimates before the minister has an opportunity to respond. Member for Lactobani.
So I didn't realize, Mr. Chair, that we were going page by page in the estimates process, but I thought possibly they were, the critic and the health minister was going global. And so this definitely has something to do with the estimates process in regards to the finances from the health department. And so in order for Manitobans to get the care that they need, deserve, I'm asking if a simple question, whether there can be that conversation to see that if this is doable or not within the budgetary allotments that the health minister had bragged about earlier today, putting in, I believe they said 1.3 billion extra into the healthcare system.
Thank you, Member for Lactobani. Minister of Health, Seniors, and Long-Term Care.
Thank you so much, Honorable Chairperson. The member for Lac du Bonnet, I'm sure, given how long he's been elected and has been participating in estimates, would understand and appreciate that that's a question better posed and more appropriately posed not here, which is the reason why the Honorable Chair had offered some advice several times here. So I would encourage and ask the member to direct that line of questioning and inquiry to my department, my office. We're more than happy to look into that expeditiously and get him the feedback and get the family clarity that they need, should they need it. In terms of out-of-province care, I do think it's important for us to talk about the different approach that our government is taking than the previous administration. Our government is prioritizing building capacity in our own province, which, you know, I have to say, meeting with experts, local physicians, nurses, other folks, they've made really clear that for years they have been wanting to build capacity right here in our own province. I've met with a number of surgeons, just as one example, who were very eager to sit down and have a conversation and talk about the ways that we can strengthen care right here in our own province. On page 89 of the 25-26 estimates book, there's a line, you know, in black and white there in terms of out-of-province program, the program and what's allocated there. Now that budget line, I think it's really important to note and to understand that the way that we really maximize our out-of-province program is by actually ensuring that we invest in more capacity in our province so that those resources for that budget line are allocated to cases where, and we have a clear protocol and process for folks to access the out-of-province program resources so that those dollars are really invested in families and Manitobans who meet the criteria, have gone through the protocol, and for folks who aren't able to access that care in Manitoba. We just don't have, for whatever the reasons are, the capacity here in our own province. Previously, that would have been spine care, as an example. But our government has made the investment so that we have the first ever spine program right here in our own province. Whereas the previous government was sending Manitobans out of the country for spine care that we can provide in our own borders at 10 times the cost per surgery. 10 times the cost per surgery. And by working with our partners locally and listening to these wonderful surgeon experts right here on the ground, we have been able to stand up a historic spine program, the first of its kind in our own province. Orthopedics is another great example. Our government invested less money than the previous administration spent on the salaries of folks working on their task force in adding almost 1,000 new surgeries for orthopedics, hips and knees in our province, 800 of which is going to Selkirk Regional Health Center. And that was an existing, they're not building a new operating room. Those are existing operating room spaces. These are surgeons who are right here in our province. Just by working in partnership, building capacity in our own province allows for us to maximize the resources for out-of-province care and to really ensure that we are approaching this responsibly and sustainably and affecting Manitobans in the best ways possible. So I appreciate that the member wanted to bring that question here today. It's not the appropriate place to do so, but certainly our team will be awaiting his question at our department level, and we're happy to engage with the family and get them the answers as quickly as possible.
Thank you, Minister. Member for Lac du Bonnet.
Thank you, Mr. Chair, and I thank the Minister for their advice. As I've shared multiple letters to the department asking for some assistance, hopefully the Minister can say yes or no. The Assistant Minister can give the family a call. That's all I'm asking for, considering it's taken 3 or 4 letters over a course of roughly 10 months So a yes or no answer to that one question. The other question I have is within the Interlake Eastern Regional Health Authority, due to funding and this year's budgetary, it seems to be some form of constraints. How many doctors are leaving or set to leave out of the public health system? I'm not talking private clinics, I'm talking the public health system within Interlake Eastern Regional Health Authority, specifically on the east side of Lake Winnipeg, Pinawa, Pine Falls, and Beausejour. But you can give me more of a global answer for Interlake Eastern Regional Health Authority. Thank you.
Thank you, member for Lac du Bonnet. Minister of Health, Seniors and Long-Term Care.
Thank you so much, Chair. I welcome that question about physician capacity in the Interlake. It gives me the opportunity to talk about one of the most exciting personal care home builds in Manitoba, the Lac du Bonnet Personal Care Home. My goodness. So excited. I wish I had a pair of pom-poms I could pull out right now, like on the day that we went to Lac du Bonnet. And literally, there were folks from the community there with pom-poms, so excited that our government was there to make the announcement. The commitment to build a Lac du Bonnet Personal Care Home, which will need physician provider in order to help support all the wonderful residents there. That was a commitment that was made by the previous government and never delivered on. Never delivered on. And our government came in, met with the community, met with leaders, and made that happen. And we wanted to reassure folks in the Lac du Bonnet community that this wasn't another empty promise like they experienced under the previous PC administration. You know, the announcement when we first went there was so exciting that the member for Lac du Bonnet himself was there, enjoying tea and cookies that we had out, and was really there to celebrate that our government was delivering on this commitment that the community had advocated for decades. And so we wanted to make sure that the community knew this was going to happen. We were going to follow through. We were going to deliver. And so we went back out to the community. I believe it was in December. It was December. Folks were very much in the holiday spirit. I remember that. And we went up there to actually put up some of the signage that was a part of the fencing, and there was machinery out there on the grounds of the site, and we went out and we actually put up the sign ourselves with the community to let them know that the work is underway, shovels in the ground. And it was a really wonderful day. And I look forward to being back in the Interlake, being back specifically in Lac du Bonnet this summer, meeting again with the community, talking about how we can continue to work together. You know, to the member for Lac du Bonnet's question, we do need more physicians in our province, certainly in the Interlake. I want to thank and I want to acknowledge the incredible work of the CEO of the Interlake Eastern Regional Health Authority, Marion Ellis. She is just a force really a force, somebody who cares deeply for all Manitobans, but certainly cares very deeply for the residents, constituents of the Interlake, and has worked really in partnership with our government to take steps to improve staffing capacity, to address really important issues like anti-racism in healthcare, truth and reconciliation in healthcare. And her leadership has really been key in us being able to take steps like opening a transitional care unit in Selkirk, a 15-bed TCU that is honestly providing some of the highest quality care, really meeting the needs of folks in the Interlake. And, as I stated earlier in my response to the critic, in terms of the numbers, the net new numbers, we don't actually have, because the regional health authorities don't track the numbers of physicians, we don't have those exact numbers available to us right now. But what I can say is that we, as of just a couple of weeks ago, the deputy and I and our team, we were talking about physicians that we know are going to be going to different places in the Interlake, including Pinawa, just as one example. And when we go out to the Interlake this summer, we look forward to meeting with folks directly and getting a better understanding, community by community, what the needs are. So I want to thank Marion Ellis and her team for all the incredible work they do, for being such a great partner. And we look forward to adding more net new physicians to the region and going further than we have so far. We know there's much more work to get done.
Thank you, Minister. Member for Lac du Bonnet.
Thank you, Mr. Chair. So again, I received no answer on whether the health minister will have their department. Mr. Chair, I'm gonna ask you, Mr. Chair, for some advice on the language that the Minister of Families is using.
Order, please. Order, please.
Okay, so
For the information of all members, Chair does not rule on the comments made offline, but I would request everyone to be nice to each other and keep a good decorum around the table, please. Member for Lac du Bonnet.
Thank you, Mr. Chair, and I think that the language being used by the Minister of Families, and the Minister of Families unfortunately is not, again, in her estimates process, and now is berating me from across the table, Mr. Chair. But that's okay. This is just what she does. This is just what she does. But I'm not going to get off topic. So I've asked the health minister to direct their department to have a conversation with the family that I had mentioned earlier. I was looking for a yes or no. That was it. Didn't receive an answer in the health minister's response. Also did not receive a response from the health minister on the number of physicians. They said how they are working towards increasing the number of doctors. How will they know whether they've done that or not if they don't know how many physicians are in the Interlake Eastern Regional Health Authority? So I guess an additional question to that is, I know from May 1st to May 15th, the Pinawa Hospital, which the health minister has referenced, only has one day that is open for emergency department services. The Beausejour ER is open part-time 13 of those 15 days, and the 2 other days, they're not open at all. So is there planning for the remainder of May, June, July, and August? And if the health minister does not track the amount of physicians, how are they even going to set any type of bars or targets in order to recruit physicians? in the public healthcare service industry in Interlake Eastern Health Authority, not just Interlake. Thank you.
Thank you, Member for Lac Du Bonnet. Minister of Health, Seniors and Long-Term Care.
Thank you so much, Honorable Chairperson. The member for Lac Du Bonnet, has a hard time. I know that. He has a hard time for some reason, despite having worked with one another for years, respecting pronouns. It's pretty straightforward. And then when he behaves as though he is, he does it in a very sort of patronizing, silly tone that really is dismissive of the seriousness of respecting a person's pronouns, which to me is sad because I know the member for Lac Du Bonnet was an educator for years. And I will say that as frustrating as it might be for someone like me, although to be frank, it's really not, I'm okay. I'm a full-grown adult here in Estimates doing my job. I'm very proud and grateful to be able to do this work on behalf of Manitobans. I reflect on the fact that, he's not an educator at this point. He was for many years, and I am relieved that he is not able to subject students to the way he subjects me in this legislature. If he cannot respect a colleague's pronouns consistently, my heart breaks to think of kids who would experience that in our communities and our schools. And so I just want to say here in Estimates that no matter where you are, whether you're sitting at an Estimates committee table or you're in a classroom or you're in a workplace, you deserve to have your pronouns respected. It's very straightforward. It's part of the reason why we brought Bill 43 forward. I want to thank the Minister of Justice for that. Now, in terms of the 25-26 estimates, if the member for Lac Du Bonnet was paying attention, he would know that our government has set targets in terms of recruiting new physicians, a really important target of 400 net new doctors. We do have new doctors, working in the Interlake Eastern Regional Health Authority. I'm thrilled to say that. We've been able to do that successfully by working in partnership with leadership there. As I stated earlier, I'm looking forward to providing more clarity on a breakdown of those numbers. Just didn't have them handy in front of me today. That doesn't mean we don't have them. The member should know that sometimes in estimates it takes a little bit of time to get that information. All of that being said, I look forward to our government doing more work. The shifts that the member for Lac Du Bonnet referenced, there is a plan in place to address all of that coverage. So our government has been making sure and working with the Interlake to establish a plan that would see those shifts covered by physicians. So that's great news. In addition to that, we have new doctors who are going to be working at the hospital and beyond that as well. So the work is underway to repair the damage that was done to healthcare by the member for Lac Du Bonnet for years. And the work is also being done by our government to repair the harm that that member and others have done in terms of gender diverse communities. And we're going to keep doing that work. So I hope that moving forward, the member for Lac Du Bonnet can, for however he might feel about me as a person or a legislator, that he can show people, especially young people, that respecting pronouns is not that hard, and that we can put our best foot forward to make sure that that's a practice we have in our province. I'm really proud to be part of a team that works hard every single day to make our province safer and better and healthier for all people, regardless of where they come from, how they identify, what their lived experiences are. And, I take very seriously the opportunity to make sure that we're setting that example.
Order, please. The hour being 5 p.m. Committee rise.